Hey everyone, and welcome. Let's be honest, most of us take our feet for granted. We shove them into shoes, stand on them all day, and generally ignore them unless they're screaming in pain. But did you know your feet can be surprisingly chatty when it comes to your overall health? Specifically, they can offer crucial early warnings about diabetes, a condition affecting millions. Because diabetes impacts how your body handles blood sugar, it can lead to some serious complications, especially in your feet. Things like nerve damage, neuropathy, and poor circulation can become real problems. So, paying attention to your feet isn't just about avoiding blisters, it's about potentially catching a serious health issue early on. This video is all about decoding those messages your feet might be sending, helping you understand what's normal and what might be a red flag related to your blood sugar. Understanding diabetes and foot health. Think of diabetes as a condition where your blood sugar is consistently too high. Over time, that excess sugar acts like a slow poison, damaging nerves and blood vessels, especially the ones furthest from your heart. Yep, your feet. This damage typically shows up in two main ways: diabetic neuropathy and peripheral vascular disease. Diabetic neuropathy is basically nerve damage. It often starts in your feet and legs, and it can make you lose feeling. Imagine not being able to feel a pebble in your shoe or a small cut. That's the danger. You might not notice minor injuries, and they can get infected without you even realizing it. Peripheral vascular disease, PVD, is a circulation problem. The blood vessels narrow, reducing blood flow to your limbs. Less blood flow means slower healing and a harder time fighting off infections. So, you can see how neuropathy and PVD together are a recipe for disaster for your feet. A tiny cut can turn into a major ulcer, and in the worst cases, it could even lead to amputation. That's why it's so important to understand this connection. Regular foot checks, taking good care of your feet, and knowing the warning signs are absolutely essential for managing diabetes and staying healthy. The 9 signs your feet tell you about diabetes. Number 1. Persistent numbness or tingling. Ever had that pins and needles feeling in your feet? We all get it sometimes, but if it's happening a lot, or if it's sticking around, it could be a sign of diabetic neuropathy. This is one of the most common early warning signs. It might be mild at first, just a slight tingling, or it could be more noticeable, like your feet are constantly falling asleep. This happens because high blood sugar is actually damaging the nerve fibers, messing up how they send signals. The nerves in your feet are super long, so they're often the first to be affected. Don't just brush it off as getting older or sitting weird. Persistent numbness or tingling, especially if you have other diabetes risk factors, is definitely something to talk to your doctor about. It's your body's way of saying, hey, something's not quite right. Number 2. Sharp, shooting pains or cramps. Beyond that numb feeling, nerve damage can also cause sharp, shooting pains. These aren't your typical muscle cramps after a workout. These pains can feel like electric shocks, burning sensations, or even just a constant, nagging ache. They can happen out of the blue, even when you're just relaxing. And they often get worse at night, making it hard to sleep. These painful zaps are basically your damaged nerves misfiring. It's a signal that the nerve damage is getting worse and needs attention. Over-the-counter pain meds might help a little, but they won't fix the underlying problem. You need to address the high blood sugar to really get a handle on it. Number 3. Changes in skin temperature. Are your feet always freezing or oddly warm? Notice if your feet are consistently cold, even when the rest of you is comfortable. This can be a sign of poor circulation, a common problem with diabetes. Remember that peripheral vascular disease, PVD? It restricts blood flow, making your feet feel colder. On the flip side, unexplained warmth or a burning feeling, even if there's no actual pain, can also be a sign of nerve damage. Damaged nerves can send wacky signals, making your feet feel hot even when they're not. So, whether your feet are constantly freezing or feeling strangely warm, it's a sign that something's up with your circulation or nerves. Pay attention to these temperature changes. They're not just about comfort. Number 4. Skin discoloration, red, blue, or pale. Take a good look at the skin on your feet. Are there any changes in color? Redness, especially if it's concentrated in one area, could mean inflammation or even an infection brewing. A bluish tinge, doctors call it cyanosis, is a serious sign that your feet aren't getting enough oxygen. That's a big red flag for poor circulation. Paleness, or a whitish look, can also indicate reduced blood flow. These color changes might be subtle at first, but they're important. Compare the color of your feet to your legs or hands. If there's a noticeable difference, get it checked out. Number 5. Dry, cracked skin, especially on your heels. We all get dry skin sometimes, but for people with diabetes, it can be more than just a cosmetic issue. Nerve damage can mess with the sweat glands in your feet, making them less able to produce moisture. This leads to dryness and cracking, especially on the heels. Those cracks aren't just unsightly, they're open doors for bacteria, increasing your risk of infection. And because poor circulation slows down healing, even small cracks can become a big problem. Moisturizing your feet regularly is a must, but if you're noticing excessive dryness and cracking that just won't heal, it could be a sign of underlying nerve damage or poor circulation. Number 6. Thickened, yellowish toenails. Thick, yellowish toenails are often a sign of a fungal infection, onychomycosis. People with diabetes are more prone to these infections because of a few factors: weakened immune systems, poor circulation, and nerve damage. The nails can become brittle, crumbly, and even painful. They might even start to separate from the nail bed. Fungal infections love warm, moist environments, and the reduced blood flow to the feet in people with diabetes creates the perfect breeding ground. Treating these infections can be tough, so the sooner you catch them, the better. Over-the-counter creams might help, but often you'll need prescription medication from a doctor or podiatrist. Number 7. Sores, cuts, or blisters that just won't heal. This is one of the most serious and obvious signs of diabetes-related foot problems. Because of nerve damage and poor circulation, your body's ability to heal wounds is impaired. A small cut or blister that would normally heal quickly in a healthy person can linger for weeks or even months. This extended healing time seriously increases the risk of infection. Even a tiny blister from shoes that rub can turn into a dangerous ulcer if you're not careful. Any wound on your foot that's not showing significant improvement within a week needs to be seen by a doctor. Don't try to treat it yourself. Get professional help. Number 8. Calluses and corns. Building up quickly. Calluses and corns are those areas of thickened skin that develop from pressure or friction. They're pretty common, but if you have diabetes, you need to be extra careful about them. Because of nerve damage, you might not feel the pressure or pain from these buildups, so they can grow larger and thicker without you even noticing. These thickened areas can further reduce blood flow to the skin underneath, increasing the risk of ulcers forming. And please, don't try to remove calluses or corns yourself, especially with anything sharp. You could easily injure yourself, and with diabetes, that's a serious risk. Regular visits to a podiatrist are crucial for managing calluses and corns safely. Number 9. Changes in foot shape, Charcot foot. Charcot foot is a rare but very serious complication of diabetes. It affects the bones, joints, and soft tissues of your foot. Basically, nerve damage weakens the bones, leading to fractures and dislocations that can happen without you even feeling a major injury. Because you might not feel the pain, you might keep walking on the injured foot, causing even more damage. This can lead to significant deformities, like your arch collapsing, giving your foot a rocker bottom appearance. Early signs of Charcot foot can include swelling, redness, and warmth in the foot. If you notice these, especially if you already know you have neuropathy, get to a doctor immediately. Early diagnosis and treatment are absolutely essential to prevent severe deformity and potential amputation. What to do if you notice these signs? Okay, so you've noticed some of these signs. First, don't freak out, but do take it seriously. Early detection and action are your best friends when it comes to managing diabetes-related foot problems. The first thing to do is make an appointment with your doctor or a podiatrist, a foot doctor. They'll be able to assess your symptoms, examine your feet, and figure out what's going on. Be honest and open about your medical history, including any family history of diabetes. Your doctor might order blood tests to check your blood sugar levels and overall health. They might also do tests to check your nerve function and circulation. Depending on what they find, they might recommend lifestyle changes like diet and exercise, medication, special shoes, or wound care. Remember, taking care of your feet is a crucial part of managing diabetes. Your feet are amazing. They carry you everywhere, and they can also give you valuable insights into your overall health, especially when it comes to diabetes. By paying attention to what your feet are telling you, you can take proactive steps to manage your blood sugar, prevent serious complications, and stay active and healthy. The 9 signs we've talked about, from that persistent tingling to slow healing sores, aren't meant to scare you, but to empower you. They're a guide to help you recognize potential problems early on. Remember, early detection is key. Regular foot checks, good foot hygiene, and open communication with your doctor are your best defenses against diabetes-related foot problems. Don't underestimate the power of paying attention to your feet. They can tell you a lot more than you might think. Found this information helpful? Please share it. Spreading awareness about diabetes and foot health can make a real difference. And if you have any questions or personal experiences you'd like to share about diabetes and foot care, please leave a comment below. Let's learn from each other and support each other on this journey to better health.